This brings us to the end of the session.
Okay.
Okay.
So if we are
Yeah.
ending the session, I just want to say, because just like a little bit of more things that are happening in the field. I want to
Yes.
say,
Sure. Yeah.
like we have actually been moving away. I mean, more away and away from doing just chemotherapy, which is kind of chemotherapy is like shotgun approach, giving a sort of like a poison to kill cancer, but it can also affect other organs. It's not a selective treatment. So we are getting more and more selective. We're getting more and more targeted in our approach towards cancer. Like I just mentioned in the lung cancer, ALK, EGFR, ROS1, these type of cancers, HER2, where you have a specific drug for each of them that go and target and attach to the driver mechanism. Now, what about immunotherapy? So there are checkpoints in our immune system. Immune system is our first line of defense against cancer. So we have checkpoints like PDL1. We have PD1. Actually, we have checkpoints like CTLA4, LAG3. These are different things which are on the surface of a white blood cell called T lymphocyte. It regulates a T lymphocyte, the function. Like, you don't want your white blood cell to be too aggressive and start destroying your own organs, but you also want it to be fast enough, active enough, or aggressive enough to go and attack cancer and kill cancer cells, right? So there's a very fine play of balance here, which is regulated by checkpoints. So what we found is, like, in people get cancers because immune system has slept or is not very active. So we can actually activate the immune system by using checkpoint inhibitors like immunotherapies. You may have heard of drugs like pembrolizumab, Keytruda, or nivolumab, atezolizumab, durvalumab, and then these new drugs, which are all PD-L1 inhibitors. So what they do is they go and attach to these brakes. So they attach to these checkpoints and remove the brakes. When you remove the brakes, these immune cells go and attack cancer cells. And what we found is these are much more easier than doing chemotherapy. Plus, they also work much longer, much durable, much more effective. And they can actually we found that some of these treatments are curing cancers in stage 4 patients. There is now literature that even in stage 4 lung cancer, patients who are responding to immunotherapies, about 15-20% of them are alive after 5 years, which equates or translates into disease being cured. So that's what everyone needs to know. There are new antibody treatments called bispecific antibodies or BITE antibodies, which are bispecific T cell engagers, where they bring a T cell, white blood cell, and attach it to a cancer cell. These are new antibodies, and they make the T cell and the cancer cell fight each other. So even in a cancer called small cell lung cancer, they found that people are alive for 1 year longer by doing these new antibody treatments, which is groundbreaking, I would say, like, because small cell cancer is the deadliest lung cancer. So we've seen bites, and now we've seen in the lymphoma, leukemia fields, they're using CAR T cells, where they extract the white cell called T lymphocyte, genetically modify it, and make it express certain antigens, and make it go and attack the cancer cells. So, and people live much longer when they're doing these CAR T cells. So it's not just chemotherapy, it's not just radiation. We have all of this. The last thing I want to say is, like, we are now making antibodies which specifically tag the chemotherapy, take the chemotherapy to the cancer cell and release it inside the cancer cell. This is called antibody-drug conjugate. We have so many things in the field which have come. So in the future, we're going to see more and more of antibody-drug conjugates rather than just plain chemotherapies.
Wonderful. So I feel So understanding this, I feel like in a near future, we'll be having a pretty good, decent cure,
Yes,
and people will stop worrying about cancer. Rather, there is a definite hope.
there is hope. I won't promise like every cancer is going to be cured, but I'll say like the cure rates are going to keep going up.
Yeah.
And again, the cancer is very diverse, like numerous cancers. We have seen improving likelihood of cure rates in each of the cancers in increments of 5%, 10%, 20%. So from 1 or 2%, we have brought it to 20, 25%. That number, who knows, can go up to 40% in some of these cancers or even more. Yeah.
Okay.